Good morning and welcome to this latest in the Elephant series of conversations around the COVID-19 pandemic, its implications, effects on our society. And today I'm very privileged to have with me two prominent Kenyan scholars. I have Professor Attiya Waris, who's with the law school at the University of Nairobi. And she's also Director of Research under the Deputy Vice Chancellor of the University of Nairobi, and is chair of the Committee on Fiscal Studies at University of Nairobi. Karibu, Professor.
Thank you.
And we are also joined, thankfully, by Dr. Mary Nyamongo, who's a social anthropologist, and she's an adjunct faculty at Strathmore. And she's also the founder director of the African Institute for Health and Development. And so she's also got that focus on healthcare policy. And thank you very much, professors, for joining us this morning for this conversation. Asanteni sana. Can I just start with a question to both of you, which is how is the COVID-19 lockdown treating? How are you? How are you managing? How are you working? How are your families? Are you safe? I can. This is the new normal. We are all on Zoom here having this conversation, but just wanted to ask, how are you doing?
Thank you, John. We are fine, as fine as it can get. The fact that you talked about Zoom, I think most of us will say we are working longer hours. We are always one call after another. I was just telling you earlier, I'm a lawyer. When I'm in a meeting, I'm looking for tea and mandazi. Now, when I'm shaking your hand, talking to you, and having a conversation. Now I have to see you online, and the internet keeps playing up. We are always working. I don't know whether anybody feels like that. Your students sending you things, you're talking, you are on a Zoom meeting, you are on a Teams meeting, you are on a Skype meeting. We are always in meetings. And as you say, is that a new norm of working? Is that the way we'll live our lives? I don't know. But the human contact is actually suffering in this process. But we are fine.
Thank you.
Yeah, well, it's Ramadan on my side, so we're not eating so much. So it is I miss my mandazi and my tea, but it's a mixed bag. The work is much more than before because we are running rapid response on research at the university out of my office. From a personal front, my brother's a medical doctor, so my brother talks to my parents because I stay with my parents outside through the kitchen, through the living room window.
Yeah.
And on Eid Day, which we are preparing for, which will be over the weekend, we're setting out a table outside for him in the garden so that we can have some kind of a family luncheon. So it's going to be, it's not easy for us, but yeah, we can't complain. And I completely agree with Mary. The workload is exponential. It's never ending. Back to you, John.
I perhaps I can start with just a straightforward question. One of the things that COVID-19 has done is bring into the center stage once again the role of scholars and academics in understanding our own condition, our own situation, our own problems, our own challenges. And one of the things that I've been hoping as a result of this is that scholars like yourselves will become even more essential to policy making, especially when we are faced with a disruption of this scale that is global. For a long time, the academy in Kenya has been alienated from policy making in many ways, really going back to the 70s, where dissent was frowned upon, and ideas were unpopular. Thinking actually was something that was feared. You're all on lots of conference calls and Zoom meetings. Is this changing? Is government reaching out to you, for advice, to be able to contextualize our response? Because we spent the first month, my sense, month and a half, talking about the epidemiology of COVID-19, the virus itself, how it is spread. Okay, we have to wear masks. If you're older, you're more, you're in greater trouble, etc., etc. But now we are now coping with the effects, the implications of the measures that were implemented to deal with COVID, the lockdowns, the physical distancing, the curfew, certain parts of the country that have been blocked off. But I wanted to ask, what's the role of academics like yourselves at this time to help us think ourselves out of this brown paper COVID bag that we are stuck in?
It's like a mixed bag question. There's positive elements to it and negative. So I guess the first part of your question is, did government reach out to us as scholars? So as an individual scholar, no, they have not reached out. As an institution, I haven't heard of them reaching out, but out of my office as director of research, what we did is we started to collate thinking from all of our academic and even our non-academic stuff as well. And we started forwarding collated sets of interventions to government. And we did that from our side. I actually wrote a blog a couple of weeks ago that was trending for quite a while, which was, do we need researchers, do we need to burst out of the ivory tower, or do we need people to break into the ivory tower? And I got a lot of feedback on it. And that particular blog was all about who should be reaching out to whom. And I think everybody should be reaching out to each other at this point in time. I think that it's unfortunate that they are not reaching out in a more organized manner. And I think my biggest concern is that existing networks and informal systems are how we are continuing to converse with each other. And I think it's really important to start showcasing and mainstreaming these issues in government as much as possible from the scholar's perspective, especially because everything is changing so quickly. So you need new ideas all the time. And that's the space of the researcher or the scholar. Back to you, John.
Thanks.
Yeah, just to add, I think what we saw from the beginning, and John and Attiya, was initially the virus was in China, then the virus moved to Europe and then to America. And by the time it was hitting us, we should have had teams together thinking through the potential impacts, who needs to be around the table. But what we saw was a very ad hoc reaction to the virus. And we were chasing it. We were, the government, the whole system was kind of in a panic. And we medicalized the virus. We started saying, we will test, we will quarantine, we will treat, we will prevent, even the curve, those terms that were basically not even coined for our context. Evening the curve, which we didn't know what the curve was. And so at first it was evening the curve, quarantine, isolate, test, if you're coming from outside, and it was for travelers. And then also, again, not contextualizing it, we started saying underlying conditions. If you are old, if you have an underlying condition. But if you look at the trajectory this virus has taken in the country, it has defied all the other definitions. Young people are getting infected, young children, older people. So it has basically not followed any of the trajectory we were looking at. And as Professor has said, the reaching out has not happened. What has happened is academicians and professionals have reached out to the government instead. Because we are in this for our people, we are not in this for anything. We are thinking we can contribute. So my colleagues, Catherine Muma, Kumodo Waiganjo, and Dr. Wakasaki, have been writing to the CS in terms of very specific topical issues. What are we doing with GBV, for instance? there's a lot of gender-based violence. What are we doing about that? When we decided to ask people to social distance, were we thinking about informal settlements? How practical is that? Who did you need around the table to say, for informal settlements, these are the measures that could work and these ones wouldn't work? And so one of the things for me, and I've asked this severally, do we have people sitting around a table doing what we call in social science scenario mapping? How will this unfold? That's a technique, that's a skill that you need to have inbuilt into the decision making on the virus. Are we doing it? I don't know, John. So I think we need to start asking questions. How can academicians help the fight against coronavirus? What can they contribute? Where can they sit? We don't mind sitting in the University of Nairobi in a meeting room and saying, this is what the government wants to do. What should it consider? People are looking to contribute. We are Kenyans. We have families that are suffering. We want to contribute. We just need a platform to contribute. So a quick answer to your question, John. We have the people in this country. We have the intellectuals. We have the goodwill. We just need to harness it. But that harnessing has not been done effectively. Thank you.
Thank you. Can I ask, I mean, from your perspectives, your different perspectives, Dr. Nyamongo, you're an anthropologist, and Attiya as the chair of the fiscal committee, the fiscal studies committee at the Nairobi University. I just wanted to get your take on the impact and consequences of the COVID-19 pandemic mitigation measures that the government has implemented from your various perspectives, because it's become clear now. I mean, I was speaking to a colleague from Mozambique, who is an academic like yourselves, who was very forceful and said that the treatment may be worse than the disease, as far as COVID-19 is concerned, and he pushed that quite forcefully. But I just wanted to get your readout. I mean, we've watched this now unfold. We're going into the third full month. What would your response be in terms of the kind of implications? We have the COVID, the virus, the epidemiology on one side, but I'm asking about the mitigation measures that we've implemented, the curfews, the lockdowns, the physical distancing. What impact has it had on our society, and could we have done things differently? What is there? How could we have contextualized it better as Kenyans and as Africans?
Okay, so let me go and then Prof will come in. We want to be as practical as we can get. If you live in Kilimani or you drive around Kilimani, there are those women who sit there waiting to be picked to wash people's clothes. Initially, there would be 5 or 10. I recently passed there last week on Friday, and there were clearly 200 women sitting along the road. So there's a time I stopped and talked to them, and they told me, from March 13th, nobody stops to ask them to go to wash clothes. But they sit there so that they can be supported by well-wishers. So if you find them there, they are not waiting for work. They are waiting for well-wishers to support them. From 10, you have 200. And when you talk to them, they say they were laid off as soon as the COVID was announced. Their employers told them to go away. And this is just an epitome of what's happening in informal settlements. So you have a population where 84% of our people work in the informal sector that has been adversely affected by Corona. And so those industries or have closed or scaled down. Those people are sitting in informal settlements. They cannot go out to work. So that's one consequence. And also somebody was telling me, look, industries are now beginning to think we can do this with 10 people. We didn't need 100 people. So when we reopen, are they going to take these people back? Prof, you can do a study on that. Are they going to take them back? I don't know. Secondly, I think the time restrictions, in as much as the effectiveness of the measures were, this is a debate we'll continue to have. It was necessary, but sometimes I ask myself, did we close too soon or shall we open too soon? We closed, we locked down, we curfewed, and then we are being told the peak is in July, the peak is in September. Dr. Ari, did we close too early? Are we opening too soon? I don't know. So the consequences will play out, and academicians, we need to monitor what's happening so that we can document it as part of the support we are giving the government. In terms of the lockdown, I will use an example of somebody I know who went home to bury father and has been locked there, left 2 children in Nairobi. She's at home with the youngest. These are 2 girls in an informal settlement. First lockdown, 21 days. Second lockdown, 21 days. Third lockdown, you've left teenagers in a house alone. You are locked up in Kakamega. What happens to you? What's happening to families? You had gone to Kisumu for work. You are locked there. Your family is in Nairobi for 21 times 3 days. I think the consequences at the household level and at the family level is something that we really do need to look at with the other measures that have been put in place. Loss of jobs came, and which is inevitable. America is recording one of the highest job losses ever. So I think the job losses are cutting across. How we choose to support our people is something that we can discuss on in this program. And so for me, the social consequences, some of the most will be sustained in the long term, and we need to begin to address those. How are we dealing with the GBVs, gender-based violence in the homes? How are we dealing with this long-term separation of 63 days? How are we dealing with social distancing in an informal settlement, which is not possible? We've seen a lot of police brutality in the last, since these lockdown curfews were started. And the people suffering are the poor and the vulnerable. So from a social anthropological perspective, I tend to look more at what are the social consequences of the decisions the government has made and who is responsible for those. And yet I don't have answers.
Thank you.
Well, on my part, I think it's a question of trust and what trust is playing out as within the communities, societies, and government. It's about humanity and whether we're cognizant of the need to be humane in this scenario. It's also a test of leadership in crisis and whether leaders are able to empathize and make decisions truly on behalf of their population. And then it's communication. For me, it's how we are communicating to each other. And I mean, I want to jump off the point of, the flattening the curve argument. From a researcher's perspective, we need data to know where the curve is. If you're not testing enough people, then your curve is wrong.
Yes.
So I don't think any African government at this point in time should be even using the argument of flattening a curve because they don't know the curve. We don't know this curve. We're not testing enough people to even build a clear curve. So, I mean, I'm not an epidemiologist, but I've been talking to my research teams at the University of Nairobi, and this is the biggest challenge facing them. They're looking at the curves and they don't make sense from a researcher's perspective. And I completely agree with Mary about the need for scenario planning because they've jumped off this sort of benchmarking approach that is happening globally to do scenario planning based on a curve that doesn't work. So literally the first 3 steps, even in how things are being rolled out, are already on premises that are wrong or hypotheses that don't make sense for us because we don't have enough information on this. But for me, the bigger problem came about from trying to understand humanity. And, you know, you hear in South Africa, there's a huge pushback against upper and middle class people, because the argument is rich people brought this disease to us.
Mm-hmm.
That is the pushback that is happening there. And it hasn't quite happened here yet. But at the end of the day, our political elites are wealthy elites. They may have started out poor, but they are now wealthy. They now have to still remember to understand lower middle class and lower classes and what they go through. And they're just not seeming to engage with that issue the way I would have hoped they would have. So I remember seeing photos online on Twitter of members of parliament going in their cars to be tested. And I'm thinking, you're testing yourself, but why aren't you testing the house help who's working for that upper class person who's now been exposed to it and is going back into the slum areas? And now you're seeing things like, 25 cases, Kibera is a hotspot. I mean, that's one of the biggest slums in the world. I know it's the biggest one on the continent. I mean, that is a critical issue. And I don't see a rolling out where there's a reflection of the humanity of people. I mean, the image of people running away from that Mombasa ferry, I think is burned into the minds of everybody. And that takes me to the issue of trust. Like, we as a nation don't trust our government, and we certainly don't trust the police. So when police are beating up people because they didn't follow the curfew, they're actually, if they're going to beat up anybody physically, which I don't encourage, then shouldn't they have dealt with the shop owner who didn't let his staff leave early enough to catch the ferry? I mean, where are you targeting your response versus who's the person causing the problem? There's this displaced reaction. So I go from humanity to trust to communication. When did you tell people something was going to happen? In the case of, it's Ramadan, the Somali community lives in Ivory predominantly. They're all Muslims, they're fasting. They broke curfew, they did things they shouldn't have done. Fair enough. But you now tell them 3 hours for lockdown, and you haven't taken into consideration the fact that they're only eating once a day or twice a day. I mean, be considerate, know your population, and then try and unpack how you're going to deal with them. And so, how are you communicating? And then what are you communicating? And that takes me to that. There was a lot of criticism against the cabinet secretary on health, because he would stand up and do a press briefing like every other cabinet secretary in the world. And I'm there thinking, I'm sitting in Kibera in my little house with my 3 children, and you're telling me the curve is like this, the number of people sick are this. And in my little home from which I cannot get out, I know nothing about where to get tested, where to go to if I'm sick. And then that has resulted in people dying in their houses because they're too afraid to come out for treatment. So then you have to ask yourself, there's a problem of trust. And these are all problems that we started with before the pandemic. And they're getting exacerbated during the pandemic, because now, and I can tell you this, like people are openly saying you can now bribe to get out of Ivory. So now everyone's discussions in different spaces is, oh, so it's different bribe, same system, which means nothing has changed. The system, the government system is not responding to taking advantage of the crisis in a sense and building our faith and trust in them, which they could have. They had this watershed moment to deal with. And instead, what we hear about is 40 million used for tea and coffee. And how is that lady sitting in a slum thinking right now with her 3 kids or pregnant with no other caregiver, and she's the sole provider, and that's your Wanjiku. And she's thinking 40 million, what could I do with 40 million? I mean, that's the reality and I think it's very unfortunate, because I think, for example, at the University of Nairobi, we have this amazing e-repository of information. A lot of our information is online, open access. It's so easy to pop in, pull out data analysis on current issues, and then pop and roll out interventions, even without us, because our data is there. And if you bring researchers in, like Mary and myself, then we'll actually give you rolling scenario planning related interventions on a daily basis, if that's what you want, because that's what we're trained for. And then as government then picks their choice on how to roll out the lockdown, see the impact, see the consequences. But I also want to pick up on something Mary said, and that is the unemployment issue. So 80% plus unemployed because they're in the informal sector. But even now, NHIF is for who? Is for people in the informal sector. So if you are formally employed and you pop out because you lost your job, you still have fairly decent access to healthcare, for example, in this scenario. But if you're a member of the unemployed and the informal sector, you have zero access to those healthcare services. People have been dying outside the healthcare institutions from before the pandemic. And suddenly, a member of parliament comes and pays for your bill and saves you. But what about now? I know of a lady who gave birth on the way to the hospital, not because there was no hospital or doctors, but because the quarantine meant she couldn't get transport. So it's not even about the health system. It's about what we call the underlying determinants of health. It's about all the other things around health, like clean water and electricity and infrastructure, that is also starting to show its weight of problems. And then in the middle of this, we have the locusts. So food is going to be a problem as well now. So that's a huge consequence that nobody's really addressing. And the dams bursting or the excessive rain also means that crops and animals are being washed away. Again, it's going to impact food. But it's not just going to impact access to food, it's going to even impact quality of food. It's going to impact whether or not we have aflatoxins developing in products that start to rot because they're not making it into the market fast enough. I mean, these are massive issues that need to be discussed at a multidisciplinary level to deal with them by government and not by just a medically trained set of personnel, which is what they're utilizing right now, which is great for the medical intervention, but it doesn't help us for the impact and consequences. Back to you, John.
Thank you. No, that's very thought-provoking, and it reminds me very early on. Singapore's response has been showcased as one of the most effective, because within that society, it's a high-trust society, very effective government, but still the Prime Minister and the Minister of Health there were quite emphatic that this is not only about the epidemiology, it's also about your governance system and trust and just it's also about governance. It's about your health system, obviously, especially your primary healthcare system, and it is. But they emphasize it's also about this is testing our governance system, and it's also testing our social capital. Which they also said is extremely important. I mean, the Scandinavians have been able to basically, when the minister of health says behave this way, the society believes, trusts, and behaves that way. You don't need. So we have turned policemen and women into our first responders. They're the ones, they're the face of the government's response to the pandemic. And I wanted to ask, and also with regard to communication, I have been following, with Pan-Africanist colleagues who have been assessing the quality of the response in various African countries, and the president of South Africa has been seen to be communicating well. President Museveni nearby, even showing people how to do press-ups in the house and how much ugali you can eat. These are things which may seem funny, but they communicate. You're communicating to people on their terms and bringing this thing home in a way that is authentic and legitimate to the majority of citizens. So I wanted you to speak a bit more into that issue of trust, because clearly we are faced with a crisis that is going to deepen before it gets better, as the economic implications of this kick in. Dr. Nyamongo just mentioned to us all the people who've been laid off already. But this is a government that was already in fiscal distress before COVID-19, and then seems to be facing a trust deficit. how does one correct these kind of things? How does one cut a suit that actually fits Kenyans, when dealing with this kind of thing, especially now that it's becoming apparent that COVID-19 is maybe around for some time. We're not likely to have a vaccine next month. Therefore, we've, and I've talked to academics like yourself who say, hold on, actually, these viruses are part of the human ecosystem. They have always been there. And societies have managed them and mitigated. But I wanted to sort of just put out those comments there as food for thought. I think because this issue of trust is now, yes, we can have this very regimented approach, lockdown, counting numbers, how many infected, how many dead. We know you're not testing enough. But then there's also the software issues that are about how people behave and respond to crisis and disaster, how people respond and also governments.
If you remember when this started, when we started getting the daily updates, we used to wait for them, sit by the TV, watch. I don't know, I bet none of you does that anymore. I wait for the scanner at the end of the day.
Yes.
The rain started beating us when it was very mechanically done. Press conference, this is happening, number dead, number tested positive. And then when you brought in the police, you basically reminded Kenya nothing has changed. It stopped being a public health intervention. It became like a military operation. I don't know, John, you are in university, maybe a few years ahead of me. When we went on strike, the police were everywhere. Yes. It reminded me of that state. That is not a public health mitigation measure, it has been militarized. Then you stop listening to government, you stop fearing them. If you've walked around, and I'm going back to Prof's issue about communication, we've told people to wear masks. And I bet a lot of people are wearing masks because of the penalty on masks. It's not because they understand why they are wearing the masks. The trust in the system continues to be a challenge. We started by quarantining people and telling people, you will pay for your own quarantine. The Tana River governor told his people, you will carry your beddings, you will carry your food to a quarantine facility. If the same government a week later says, don't worry, we shall pay for quarantine, who do you believe? Will you trust these same people that after they've quarantined you, they will pay, after they've initially told you to carry your own bedding and your own food? If you are a true Kenyan, John, you will not trust that government. So trust is a big issue. The other big challenge that Prof brought up is the issue of communication. How are we communicating? The biggest challenge we are having, Prof, with people in Kawangware, intellectuals like me, people I was in campus with are telling me, there is no one person in Kawangware who has COVID. Those tests they're talking about, nobody can say Mary Nyamongo of plot 5 was found to have COVID. This is because we do not communicate issues to do with asymptomatic patients very well. Have we communicated, John, that my young man who is COVID positive will be taken in, has not had a headache, has not had anything, and then he's released after 14 days back into the community without having a symptom. Kenyans, you are sick because you have a symptom. You are sick because you have a headache, you are coughing. But you take me to a quarantine center, I have had no headache, I have had no cough, I have had no difficulty in breathing. Those are the symptoms you've told me are symptoms for COVID. You put me in an isolation ward, after 14 days you release me. I go to the community in Nasema, these people just wanted to eat money. How are we communicating? How are we building trust? Who do Kenyans trust in communication? We trust our religious leaders. How many religious leaders are we involving? The Eastleigh issue. Did the cleric in Eastleigh call people and tell them, because the cases are many, it's Ramadan, we are meeting, these are the measures that we need to take, to put in place. They would have listened. I've asked this question again. Who do we trust? We know historically we don't trust our government. And if we're going to be sincere with ourselves, we could ask, in Isli, who do they listen to? In Kibera, who do they listen to? If Raila went there and talked to them, I'm not mentioning this because he's a politician, but would they listen to him or their MP or whoever? In Kawangware, is Simba Arati a man they listen to? Let's be also realistic as we communicate. Who do people listen to? So we are communicating, but people may not be listening to us because we are not tapping into the resources at the community level. So trust and communication are important as we go forward with this. I just thought I needed to build on what Prof had said about communication and trust. Lastly, this Mombasa deaths, and we keep asking this question. Do we trust the government enough to say, my person is sick, I will take this person to hospital, and if it's COVID, the government will treat me well? In the US, even if you are positive, you are quarantined at home. In the UK, even if you have the symptoms, unless they are adverse, you are quarantined at home. So that's when the rain started beating us. The way we looked at positive cases, and I'm hoping we can talk about stigma. We've now stigmatized COVID. If I go to my village now, I'll be told to be quarantined. There's this man who came, a Meru man who came from Mombasa, who could not attend his father's burial because the community said akona corona. So he wasn't allowed by the graveside. We've stigmatized a condition that should not have been stigmatized in the beginning because of the way we communicate and all trust issues.
Can I jump in on that as well? Because when we were looking at quarantining, I kept asking, who's going to get permission to move from one city to the other? So I've been asking people, do you know who's moving? And it's the usual suspects. Like, it's people with connections and networks who are able to get access to move from one town to the other. But when you look, and earlier Mary also mentioned a family split between two towns, what do we do? Now, that's a case where you should try and get a family together, because in times of emergency, there is fear. And when you're communicating to your population, you need to calm your population down. You need to reduce their fear. So how do you do that? You expedite permission to get families to stay together. They're safe in their homes, and they're not constantly worried about family members somewhere else. But who's actually getting permission? From what I tell, if we do and we can audit of who got permissions, I think it's important. I hope they have kept records. We should do an audit and see who actually got permissions to move in and out of towns and cities. Because I think, from what I'm hearing, it's upper class and middle class and political elite. And I think that's unacceptable. So we need to, like I said, it's a watershed moment. This is the time to talk to us. And when it comes to, Mary talks about, it reminds her of the old, I'm a lot younger, but it still reminds me of when I was really young. Because when I look at it, we came from the era of presidential edicts. And for a while now, if you were in a car by yourself alone, you're supposed to have a mask on, because if you did, you get stopped, you get fined, or you you get your way out of it, in different ways. And now it takes a release of a statement by the presidential spokesperson, right, to tell the police not to stop people who are by themselves in their cars if they don't have a mask. I don't understand that. Shouldn't that be the police spokesperson? Why is it the presidential spokesperson? So even it's not even about what they're communicating. It's also about who's communicating versus who's the authorized person to communicate. And so if you're trying to set up your good governance system, then let's look at our constitution to it, because some of these things are simple, don't need to alarm people. But also, one of the interventions that some of my team did submit was about, please make sure that the police know how to communicate. And I mean, it's great. People are posting up on Twitter, pictures of ladies helping, police women helping ladies to get home. But we shouldn't have one picture like that or 5 like be inundated with police looking after human beings. They need to shift their mindset. And I mean, I love what you said, John, about the Scandinavian countries. They follow instructions. But here's the big difference. 50% of Norway's normal budget is on healthcare. 50. We give 2 to 3% of our budget to healthcare. So they know their health system. They trust their health system. We have almost no healthcare system, and we don't trust it anyway. I mean, that's the reality. Of maybe a bitter pill to swallow, but that is what it is. And a couple of years ago, all the heads of states committed to spending a minimum of 15% of their national budget on healthcare. To date, the last data set I saw was 2018. Only 5 African countries out of 55 have done that. The money is not being put into the places it should be put in. Therefore, the result is going bad results. We have to take the reality. And let's not forget that I think the population of Norway is maybe 5 million, and we are 50 million Kenyans. And we are spending so much less, and we're a weaker economy. So it's literally becomes like I want to say snowball, but it reminds me more of a crocodile sitting in the water, and you can only see its eyes, but wait until it opens its mouth. You're in trouble. You don't see it. All you see are the little eyes looking at you, trying to sort things out for you. So I like the conversation it's going in, but I've also heard arguments that, and this is from people who live in the slums, because I've also been trying to talk to them. They say things like this pandemic is ours. It's been cooked up by government because they're trying to destroy our lives further before the next election. I've actually heard that said aloud. Then somebody said to me, have you seen anyone infected? Have you heard of anyone do you know them personally? The same argument Mary is giving. And the moment you say, no, I don't know anyone, then they're like, well, then it doesn't exist. That's literally the resting point, which takes me to the communication issue. Know your people. The only way your communication is going to be effective is if you know how to communicate to your people. For you to know how to communicate to your people are not a bunch of professors. No. Your people are a bunch of people living at below $3 a day. So learn to communicate to them. And that is the only way you will actually effectively communicate to them. Because you need to know them. You need to know their realities. And then you need to speak to them in a language that they understand. I mean, I was for the longest time looking for vernacular communication. I haven't seen too much communication in place in different vernacular languages. I don't see little leaflets in Kikuyu and Luo and Luya and Kisi, right? You say flatten the curve. Does a person understand what flatten the curve even means in their traditional languages? Like, let's be realistic. Know who your people are, and then and deal with it that way. But the fiscal distress we're going into, I think we were already in a crisis. Government was almost bankrupt before going into the pandemic. I don't know if that's official information, but that's my understanding of the coffers, as it were. And I think that the biggest challenge they're facing right now is their inability to be flexible. So they were already in a mess. Now they see the money coming in, and they're using the money to actually pay off previous debt. So for example, they released a statement that university staff are now going to be paid salaries that's been owed to them for 5 years. I'm not complaining. Government owes me like 2 years worth of salary, I think. But at the end of the day, this is money for the pandemic. So where's your thinking and where's your flexibility, and why are you not doing that? And it takes me back down to the same starting position. We are maintaining the same relationships and networks, and we are using business as usual in a situation unusual. There is nothing normal in where we are, but we're still using the same systems that are in place. And I think that this thing of not knowing who is infected is a real problem. I know I'm jumping back and forth, but it was because I recently heard that Facebook is giving access to data so that you can track and trace contact. Yeah. And I mean, my first question was, wait for the lawsuit, because you used my data without my permission on tracking and tracing me. Yes. And we know Kenya is becoming a fairly litigious society. But on the other side, I kept thinking, you don't know who the contact circles are. But if you don't, at least, I know because of taboo, we have to be careful. At least say, if you are near this supermarket on this day, 3 people have been tested and found positive, please check yourself for symptoms. Like, give people information that they can work with. In the meantime, I mean, I live in Parklands, and rumor has it there's a building in Second Parklands that was shut down. That's how we are working. We are talking to each other to inform each other on contact circles, when government could just send out targeted information to spaces and say, guys, there's an issue here, be careful. If you are out and about on this day, check yourself, right? There are ways and means of doing this, and that are not complicated, that are quite simple. And this is where existing structures use members of parliament, use your MCAs. But he touched on a really important issue, which is that the problem we have is because our elections do not tend to be free and fair. Please, I hope nobody sues me for saying that. But because there is a presumption of it or a reality of it, at the end of the day, we have 2 to 3 sets of leadership in this country. We have the elected leadership, we have the actual leadership down on the ground people have faith in, including religious leaders, and then you have the leaders that are basically scrambling to try and give guidance, like us, in an unusual situation. So this is a problem. Oh, and I've even left out the 4th one, which is our ethnic and community-related traditional leadership. So you now have to engage across all of them if you want to deal with them. And you can no longer turn around and say, ignore chiefs, and I mean the traditional chiefs. You cannot ignore religious leaders. You need to move into those informal systems now, and they need to be formalized in some way by being absorbed into the structures of communication, which is not being done at all. Instead, it's the Nyumba Kumi thing, which frankly, most people see as some kind of nosy, busybody neighborhood system. So nobody even likes it. They're like, who are you? Why do you need to know where I have my car? Like, people ask questions that they shouldn't be asking. They're impolite or improper because they think Nyumba Kumi allows them to be nosy about their neighbors. So we have to be really careful about all of these dynamics. And yeah, I think we have amazing people in the country who can help government. I just hope they listen. Back to you, John.
Thanks. Dr. Nyamongo, you seem to want to add to that, to Professor's comment a couple of times there.
Yes, just the thinking that we are not structured in the way we do things. We are in the middle of a pandemic. We authorize for demolitions to be done. Are we government working as one? John, are we working as a unit?
Yeah.
We are telling people social distance, wear masks, stay indoors. We are demolishing households of poor people. What is so difficult in waiting for the pandemic to ease out before we do some of those things? It really bothered me that as a country, we are not, as leadership, we are not working together. If you asked anybody, those demolitions should never have happened, not now, but they did. The other thing is some of our ad hoc measures, and this I bring it here because it's really bothered me, Prof. You go to a supermarket, there's somebody with a gun pointing at your head. So I asked one of them, if my temperature, what are you looking for? Temperature which is high. What will you do if my temperature is high? What will you do? And I'm not so sure they know what they'll do. What he told me, I'll put you on the side. Then what? Which mandate do you have? So some of our ad hoc measures are impossible. Then I visited my friend in an estate in Mangata, and the watchman at the gate had a gun, pointed at my head. So I called my friend and said, what is the import of that? How is he using the data? If my temperature is 39, what will he do? So some of these measures, we are throwing them around without knowing what next after that. You are screening me, then what? You are measuring my temperature, then what? And the other sector we need to talk about, John, before we finish, is the whole sector of education. We are online. We are all these children are playing around in estates. We've kept them at home. We are thinking of opening. We are not thinking of opening. the study yesterday said only 22% of children in this country have access to online learning. Those are your children, those are my children, those are my neighbors' children. The majority of children in public schools in this country have no access. We are still, as a government, wondering when to open, when not to open. We really need to have a structured conversation about going back to school. That conversation, I'm hoping, Prof, you are having with your people in the university. John, you will organize a serious conversation around when do we open? What are the bare minimums for our learning institutions before we allow our children back to institution? But we cannot start saying, watch TV, or have a gadget. I have a child in standard 6, another one 8, another one in Form 2, another one in Form 4. What are you telling me as a parent? I have 4 TVs, I have 4 tablets, I have 4 computers, or what are you communicating when you tell me there's online learning? As I say, people will go back to what is the bare minimum for schools, even the university, Prof. Before you allow your students back, what are your bare minimums? Washing facilities, distancing, your lecture halls have 300 students. Where will they sit? So those are the things we need to be conversing about. Our education system is going to be the biggest culprit of this virus unless we are very structured in the way we are having a conversation about how to reintegrate children back in schools and how not to disenfranchise the poor who are suffering from lack of education currently. Thank you, John. Back.
Thanks.
Mary, I love what you're saying because the temperature, sorry, John.
Go ahead.
The temperature thing really confused me, So they check your temperature and then I'm thinking to myself, so, okay, I don't know what he's going to do when it goes over 39, but in my head, I'm thinking, what am I going to do if it goes over 39 as well? I don't know. Like, what's my reaction here? Freeze, panic, move away from everybody else really fast, get back in my car. Or what if I'm not in a car? Even for me, I'm thinking, come on, government, roll out something for us here. Put up a poster. If you figure it out and you're in a public space, what to do? Even that is instruction that people need. So, I think there's all of that. But coming back to the issue of public schools, and I think that all educational establishments, I think globally, are going to be in a crisis. And I have to say that big positive support for Professor Kiama, who's the current Vice Chancellor of the University of Nairobi, because he immediately set up a task force. So we have a Vice Chancellor's task force on COVID. I'm a member of it. I head the research docket on it with Professor Anzala, who's on the National Task Force. And we have other dockets, including education preparedness and all the others and medical reactions. And I can always give you details on that later. But Professor Kiama's idea is to get us up and running as a university and to already do our scenario planning in advance. So we're already working on that. And maybe some of the things that I've been talking about with people, and we gave an intervention to government about it, is if we only have 30% internet penetration, this is the time to write out documents and little booklets and send them to the villages by post office. Suddenly, the post office can be our solution for those who are outside the Wi-Fi grid. So I love the idea that you're floating those balloons and more people have access. But at the end of the day, the University of Nairobi takes in students, and this is not considering the other institutions, but we take on students from across the country, literally from the fringes of the country. So post office is really the place to start off. And it is the place to get written hard copy material out to them as quickly as possible. And we have to work with the issue of copyright. We have to say that copyright has been put aside for this period because that's going to cause the concerns as well. We have to just get our children educated, because here's the other problem. If we don't graduate the next batch of medical doctors this year, then we have less doctors next year. If we don't graduate the next batch of engineers or computer scientists, again, there'll be less next year. So we cannot afford to hold back the education system, but we do need to make sure that young people are educated, and we need to move them really fast. And I think that is something I've not seen. I don't know if other universities are doing it, but our task force is very active. and we are constantly providing diversity. So yes, you're absolutely right about hand washing. We are looking at setting up hand washing stations, but here are other concerns we're going to have. What happens if the water gets cut off? Then what do we do? So the realities of the national infrastructure are going to be as much a challenge within urban settings as it is going to be in rural settings. Mm. And so that is sort of the sort of things we're looking at, even as we look at it in detail. And yes, we said we have 300 and 500 can enter a certain classroom, but now because of the social distancing, it's now 100 can enter, or maybe 80 are going to be able to enter. So we're looking at doing digital platforms at the same time as face-to-face. So we are exploring a lot of ideas. I'm actually very excited. I'm so delighted to be on that task because we're doing good work and we're really trying to set ourselves up and be ready. And I hope other institutions are doing the same. Back to you, John.
Okay. Well, thank you very much, Professor Attiya Waris and Dr. Mary Nyamongo. You know, we've gone over an hour because talking to you, it's so rich a conversation. So let's call this part one, because I feel that we haven't covered all the ground, and I still have some more questions to ask you. And so and we also had one of our panelists was unable to log on due to internet challenges. So I would like to say asante sana. That has been very, very insightful and illuminating. I am, you know, we are very proud of you as scholars, and one of the big resets I'm hoping that COVID does for us in Kenya and across Africa is to bring people with the knowledge, experience, and scholarship, such as yourselves, back to the center of policy making. Otherwise, yes, we are all having our temperatures taken by watchmen as we enter malls and other places. Where does it go? And even if it shows that your temperature is 40 degrees, what do you do? You're terrified of being taken into quarantine and having to pay for it. But I'm looking forward to another conversation where we can discuss what would you do? What would you undo? What mistakes have we made that need to be undone? And then how do we build this social capital and this trust that is essential for our response to COVID-19 to be successful? So, ladies, until next time, I am taking this opportunity live to plead that you join me next time so that we can complete this conversation.
Thank you very much.
Thank you.
Thank you.
Thank you. Have a good afternoon. Bye-bye.
You too.
Bye.
Goodbye.
Bye-bye.